Good morning. This is All India Radio Kohima. The morning news are read by Jonas Yantan. Nagaland Chief Minister Nipirio, accompanied by Ministers S. Pangyupom and Niba Grono, visited a quarantine center at Merema and COVID-19 hospital at Naga Hospital Authority, Kohima, NHAK, and reviewed the preparedness for management and containment of COVID-19. At Merema Quarantine Facility, Rio encouraged the health personnel to intensify their effort on the preparedness. He encouraged them to be more careful in managing such pandemic, especially in cities like Kohima and Dimapur. The Chief Minister also reminded the officers in charge to look into the welfare of the working personnel at the health facility. At NHAK, Rio stressed on cleanliness and maintenance of good drainage system at the hospital premises. He reminded the department to put forward proposals for any requirement towards improving the health system at NHAK. The centre has said that positive cases of coronavirus in the country has increased and asked states to launch intensive drive to trace the suspected contacts. Briefing media in New Delhi yesterday, Joint Secretary in Health and Family Welfare, Lava Garwal, said movement of the people associated with Tablighi Jamaat and Nizamuddin in the national capital has increased the number of cases in the country. Agarwal said 1,800 people have been hospitalized and sent for quarantine. He appealed that religious congregation should be avoided and social distancing should be adhered to during lockdown. Minister of Planning and Coordination and State Spokesperson for COVID-19, Niba Grono, said that till yesterday afternoon, 32 samples from Nagaland have been sent for COVID-19 test, out of which 25 were found negative, and the results of 7 samples are awaited. Grono said tracking is going on to ascertain the detailed information of each and every such individual from Nagaland who may have attended the Nizamuddin Margach religious congregation in New Delhi, from where some COVID-19 positive cases have been reported. Health and Family Welfare Department has identified Dimapur District Hospital as COVID-19 hospital. Therefore, the department informed that no new patients will be admitted in the district hospital, Dimapur. It said all suspected COVID-19 cases or flu-like symptoms from any private hospital or public health center will be referred to the hospital for screening. Meanwhile, all existing inpatients in the hospital requiring further hospitalization will be shifted to other designated hospitals, which includes Christian Institute of Health Sciences and Research, Zion Hospital, and Nikos Hospital. In Mukokchung, Imkong Lipa Memorial District Hospital has been identified as COVID-19 hospital. Principal Secretary Health and Family Welfare, Menokol John, informed that no new patients will be admitted in the hospital with effect from 6th of this month until further notice. He said the existing inpatients requiring further hospitalization will be shifted to Lenjem Hospital, provided they can be safely moved. Meanwhile, Longling District Hospital has also been identified as COVID-19 hospital. According to an official bulletin, medical services for other patients are to be taken up by converting Nyingching Government High School Longling into a makeshift hospital at the earliest. Legislators in charge of monitoring the Kohima District COVID-19, Minister Housing Tombang Ozukam, and Advisor Urban Development and Municipal Affairs Dr. Nikesale Nikikere, along with Advisor Veterinary and Animal Husbandry R. King, visited quarantine centers and health centers under Chubobozo and Zeminu subdivision yesterday. During their visit, the legislators examined the status of preparedness levels. The legislators also interacted with the respective medical officers and area administrative officers and took note of their grievances. The team also visited BWD Guest House and Primary Health Center, Topema. In a short meeting held at ADC Zemini office, Minister Dongbang and Advisor Dr. Niki expressed satisfaction on the overall preparation and acknowledged the efforts of every individual and line departments involved. With that, we end the morning news. Have a nice day.